All right, I obviously get a lot of questions about inversion tables and spinal decompression. What do I need to do? And I usually say, look, try a bunch of these things first. There's a lot of different ways to get some decompression done on your spine if that's what you have been either diagnosed with needing or have concluded that you feel better after you've decompressed yourself. So here's just a basic physio ball. Obviously, let your hips hang one way, torso the other way. We'll get into an ab chair here. If you got access to a gym, these things are in almost every commercial gym. Just get up in there and let those legs hang maybe a little bit further out, kind of in front of you, so you don't cave into hyperextension with the lower back. You can see how that really pulls the spine apart there. You can do it in on a dip bar. So that's just a basic dip bar that you find in almost any gym. Most garage gyms have something like that. And then if you jump up into like a dip position here, this usually helps me a lot. Like if I feel a little compressed up, I jump up on here and do a little shake like I'm going to do here at the end. And this always kind of releases me or my lower lumbar spine, and I get a nice little clunk in there, and it feels usually quite a bit better. This is probably my favorite way to do it here, especially if you don't have like flexion intolerant disc issues, but hyperextension bench here, because obviously the anchor point's at your hips here. So this is all targeted, at the hip and really right where you need it in that lower lumbar spine. And then a basic even lat pull down. You can use that knee pad there to really kind of like pull yourself down. You can play with the arm positioning to see which way is kind of stretching and or opening that up best for you. This is my favorite way, I think, here out of all of them, just the accentuated hinge, because that's kind of the natural mechanics that you need to be grooving anyways. Plus, it does do really well with decompression. So here I like to just get in this position and then just breathe deeply with your diaphragm. Okay, barbell dead hang. So if you got a Smith machine or even a barbell setup, obviously make sure it's secure, but that works too. And then obviously a pull-up bar. If you have good shoulder health, this is, probably one of the best ways as well. Plus, you're getting a lot of movement in other joints that you need as well. So lots of other ways to do this. You don't always need an inversion table.